Solidarity forever, for the union makes us strong. Again. Solidarity forever, solidarity forever, solidarity forever, for the union makes us strong. Viva health workers, viva! Viva! Viva KUCO, viva! Viva! Viva KEHPHU, viva! Viva! Viva KUNAD, viva! Viva! Viva KNUMLO, viva! Viva! Viva KHPS, viva! Viva! Viva health workers, viva! Viva! Thank you.
Thank you. I think before I do so, it's good to introduce the team which is here. We have the Kenya National Union of Medical Laboratory, represented here by the chair and the general secretary. We have the Kenya Union of Clinical Officer, I speaking, the general secretary, and we have our treasurer here. We also have the Kenya Environmental Health and Public Health Practitioners Union, that's KEHPHU, represented by the general secretary. We also have the treasurer, and also the chair is not around. No, the chair is not. Yeah, I'm sorry. I have also my deputy secretary general for the Kenya Union of Clinical Officer. We also have the Kenya National Union of Nutritionists and Dentists, Dietitians, KUNAD, represented by her, who is the Honorable Treasurer. The Kenya National Union of Pharmaceutical Technologists, here also represented by Honorable Iruga. And also we have the Kenya Health Professional Society, KHPS, representing all the other associations, associations that represent healthcare workers who do not have unions. So that is good to make it clear. As such, we met here today to consider the recent Council of Governors declaration regarding several issues, including the absorption of the UHC workers and the status and the career guideline. And that's to mean implementation and also development of the career guideline for healthcare professionals. We have come up with a statement that we want to issue today to inform the public of our position and our finding in the statement and what the Council of Governors stands out to be. As I have said, the undersigns, our deliberation were informed by the grave and ongoing threats to healthcare service delivery across the country by the Council of Governors. We take strong exception to the Council of Governors, which exacerbates long-standing problems facing healthcare workers rather than resolving them. Our key findings and our position to the same is: 1, the absorption of the UHC workers into permanent and pensionable terms and their seamless transition to county government is long overdue and remains an urgent national priority, which we are not going to negotiate. 2, contrary to COG assertion that it is not the bottleneck, the caucus hold an evidence-based position that COG has persistently obstructed the absorption process of the UHC staff. In the course of last year, it should be remembered that there was a national health strike by the workers, especially the UHC staff, and which prompted the Joint Senate and the National Assembly Health Committees sitting on 2nd September 2024, which directed the Minister of Health and the Council of Governors to collaborate on converting the UHC staff into permanent and pensionable. Unfortunately, the Council of Governors later on declined to implement that directive, citing the 2023 Intergovernmental Summit resolution, which had allowed them to give 3 years contract. This meant then disregarding the parliamentary direction. This raises legitimate constitutional concerns as to which body has the superior authority on national matters, Parliament or the Council of Governors Summit. The Public Service Commission constitutionally established independent commission, advised in 2022 and 2023 inter alia that the UHC contract be extended for 1 year and thereafter absorption into permanent and pensionable. The Council of Governors Summit purported to nullify the Public Service Commission advisory. Such an action is unlawful and indeed atrocious. Since February 2025, the UHC staff have engaged in strike action and other lawful protest measures to compel the inclusion of absorption funding in the 2025-2026 budget, which indeed happened. During this period, the Council of Governors unfortunately, remained silent on this matter, and on the other instance, under certain cases, they instructed chief officers to threaten the UHC staff who were involved in peaceful protest. I'm saying that they remained silent, as the Council of Governors remained silent on the issues to push for budgetary inclusion to absorb the UHC staff into permanent and pensionable. But unfortunately, on the other case, instructed the chief officers to threaten our UHC staff, including stopping of their salaries. Now, during the same period, it is unfortunate, and we have to list Kirinyaga, Kiambu, Nyandarua, Nyeri, Tharaka Nithi, among other counties. We have noted the naughty one, wrote to the Ministry of Health to stop the UHC workers' salary. We an action that we condemn with the strongest term possible, which is, as we term it, punitive, discriminative, and contrary to the fair labor practice. Governors refused credible engagement. It should be noted that during the strike, we tried to engage them. The governors refused credible engagement with the unions on an absorption framework during the strike period, frustrating the institutional social dialogue required by law. We hold the position that only after Parliament ensured budget provision for absorption did the governors publicly respond, and even then, they have chosen resistance over facilitation. Their conduct show lack of genuine engagement and bad faith. Deliberate salary delay, this is another issue that we have experienced deliberate salary delay, non-remittance of third-party deduction, stoppage of union dues, deduction, refusal to promote or recognize qualification, and issues of exploitative contracts by some counties are widespread and unlawful. This action violated the Employment Act 207, the Labor Relations Act, and the relevant constitutional provision, and it also contravened the International Decent Work Standards. Therefore, the Council of Governors also recent attempt to instruct Public Service Commission to stop developing or establishing the career progression guideline for healthcare workers and to withdraw previously approved career guideline is unconstitutional, atrocious, and void. The Public Service Commission is an independent constitutional commission and they cannot lawfully take instruction from the Council of Governors. Under the Constitution, the fourth schedule, health policy is a national government function, where counties are responsible for county health service. Labor standard and the national policy instrument, such as the career progression, remain, and I repeat, remain a national function that counties cannot lawfully override. The Council of Governors recently attempted to instruct the Public Service Commission to stop developing career progression guidelines for healthcare workers and to withdraw previously approved career progression guideline is unconstitutional, atrocious, and void. And it is our position that the Public Service Commission is an independent constitutional commission and cannot lawfully take instruction from the Council of Governors. Under the Constitution, the fourth schedule, health policy is a national constitutional function, where counties are responsible for county health services. Labor standard and national policy instruments such as the county public service, such as the career progression guideline, remain a national function and the counties cannot lawfully override it. The Council of Governors extraordinary meeting ignored persistent and lawful salary delay and they chose instead to attack unions, a misplaced focus that fails to address the underlying causes of crisis. The caucus will not accept continued illegal pronouncement by the Council of Governors and hereby reject any directive purporting to restrain constitutional bodies, including the Public Service Commission, from developing or implementing the career progression guideline. If the Council of Governors find management of the health, and this is what we are giving them as a solution, that if they are finding it difficult or rather burdensome to handle or rather to manage the issues of healthcare workers, they should support the establishment of the Health Service Commission and a proposal. This is a proposal that all the unions are prepared to support to permanently resolve the county labor, the healthcare workers and the labor issues in the health sector, including all challenges that have contributed to many strikes. The continued refusal by the Council of Governors to implement the SRC third and the fourth salary review recommendation and their failure to budget for lawful salary adjustment violate Article 230 and undermine the constitutional salary setting framework. In this regard, the caucus hereby demand as follows: that one, all the UHC workers must be absorbed into permanent and pensionable term before and not later than the end of September 2025 without further delay. And this must be backdated to 1st July because the budget covered, or rather with the allocation covered, or rather was provided from the 1st July. There has been a delay and that money should not be lost. The formalization of the harmonization of salary must be backdated to 1st July. I'm making that clarification because I know that the ministry has been insisting that that must be done effective September. All exploitative and punitive contract issued by the county government, respective county government, must be regularized to conform with the statutory and the constitutional requirement or standards. Immediate resumption of the union dues, deductions, finalization of the recognition agreement and the collective agreement respectively, particularly in Kiambu, Kirinyaga County, and also the Tharaka-Nithi. Those are specific counties that has since stopped deduction for the unions. But for the issues of collective bargaining agreement and recognition agreement, as we have insisted, must be done centrally. The CBS must be negotiated centrally. As national labor standards, counties are obliged to implement duly concluded agreements uniformly. Relevant agencies must ensure counties pay salary timely and remit a lawful deduction without further delay. We therefore provide that any directive or attempt to undermine Public Service Commission work on the career progression guideline, which is ongoing, is unlawful and will be resisted. We call upon the National Assembly and the Senate to investigate the mistreatment of healthcare workers by the county governments and to provide lasting remedies. We give a note that the healthcare workers cannot and will not tolerate continued systemic injustice, impunity, and blatant constitutional violation by the Council of Governors, and therefore, unless immediate corrective action or measures is taken, the caucus warned that an arrest in the health sector will be escalated within the next 21 days from the date herein, signed by the same caucus. That's the end of our statement. I'll allow the team here to give some clarification, but before then, allow me make a few statements. That it is really bothersome that the institution like the COG, which primary mandate is to coordinate issues of common interest as outlined in the Intergovernmental Act, it is very clear that they are supposed to coordinate and facilitate services, but they have become and always act like the unions of the governors, and always pronouncement that they make have stood out to be anti-employees. They are anti-healthcare workers in this case. We have never seen in any case that the Council of Governors stand out to protect or even to issue statement that propel service delivery by the healthcare workers. The healthcare workers under the county feel so much frustrated by virtue of the action of the Council of Governors. It is the Council of Governors which brings together all the governors who are the bosses of the counties. And we continue complaining. Today, we raise the issues of salary here. We have Kisumu that has taken 2 months without pay. We have Narok, the same case. We have people who are working, who are healthcare workers in county like Marsabit. They have never seen their salary for the last 3 months. You can't see the Council of Governors talking about the same. We have counties like Kirinyaga that has never promoted a single healthcare worker since its inception. But we have never seen the Council of Governors speaking about it. When we raised this issue, when they were full council governors sitting, there was not full, but we had a number of them, the chair of the health, the chair for labor, and the deputy chair for the Council of Governors, and actually they are majority whip, they are whip. We asked, by then Waiguru was the governor, why is it that they can't speak to the situation in Kirinyaga? They asked that hiyo hatuwezi ongelea hapa, and later on one of them says, who will bail the cat? That's the kind of discussion that these governors should be talking on, how to ensure that they facilitate service delivery, not to frustrate service delivery. Just imagine, healthcare workers go on strike for several months, pushing for salary, for budget allocation, to provide for absorption of the UHC staff who have worked under a very deplorable situation that they cannot even access medical services in punitive contracts. The money now is provided, but you see Council of Governors coming there to stand, and yet we never see them advocating, not even requesting for money. These people work under counties. It was actually the responsibility of the Council of Governors to ask for money, so that then the National Assembly allocate resources for them to put them on permanent and pensionable. After a long struggle of more than 3 months, you see Council of Governors standing there, opposing poor people who cannot even access medical services. They don't have even places to sleep. They sleep in slums. These guys have several homes they own. They own, a number of them own more than 3 homes. They come to compare with them with the healthcare workers. This is quite unreasonable, and we will not tolerate it. We will speak about it because they are facilitating corruption in this country. The issue that we really we are brought here today Why is it that the national government do things as pertain to the policy, the Council of Governors do not? Take an issue, for example, that the SRC have been doing review for salary for all the state officers and the public servants. They started with phase 1, 2, 3, and 4. The national government has improved, has actually provided for the same and implemented stage 1, phase 1, 2, 3, up to 4. The Council of Governors has not implemented from phase 3 to phase 4. And they come there to raise issues that they need money. Need money for what? And yet they have never even budgeted for it and asked it from Treasury. They will have spoken about it before we start raising the issue. And that is why we say we have issues that are affecting healthcare workers. There are mental issues. They have now mental challenges. They have been pushed to mental challenges, and we are not willing to take it anymore. Today here, as a caucus, we have resolved to give a 21 days notice that they must address this issue as they have been raised, because we are going to serve with them with a formal notice. If that will not happen, we have no choice, but that we will actually respond to the strike they called themselves, because it is the Council of Governors who called for this strike. Thank you very much. Allow me, Odipo will start, then we'll go to KEHPHU, to mzee ni utamaliza. Ayo ni mzee. Ongea wa mwisho. Then him, and then him. Oh, na wewe.
Thank you very much, Bwana Katibu. My name is Odipo Nicholas. I'm the National Chairman, Kenya National Union of Medical Laboratory Officers, better known as KNUMLO. Today is a very sad day for the healthcare workers of the Republic of Kenya. Since devolution, healthcare workers have not known peace. It has been battle after battle after battle, because we are dealing with unreasonable people, people who only think about themselves. We are standing here to call out the governors and the Council of Governors for their recent pronunciations and declarations that are anti-healthcare workers. We are perturbed as unions that we have been dealing with issue of UHC absorption since 2022. And the weak link in absorption of UHC workers are the governors and the Council of Governors. It has been mentioned chronologically how governors have been frustrating absorption of UHC workers. And in recent time, after the unions and UHC workers had lobbied for allocation of funds into the 2025-2026 budget, the governors who are largely silent during that period of lobbying are now coming out to speak and pretending that they are speaking for the UHC workers, but in real sense, they are not speaking for the UHC workers. They are speaking for themselves. We must tell them that we are not going to allow any more bottlenecks in absorption of UHC workers. We are going to do everything possible to ensure that UHC workers are absorbed and letters of permanent and pensionable terms issued in September. We are not going to allow their contracts to run down until May, the way Council of Governors wants it. Council of Governors must know that they are not the Constitution. We have a Constitution that governs this country. But on all pronunciations of the Council of Governors, they seem to have their set of laws that they are using and not the one that we know. Our people have suffered under the county governments. Promotions are not coming. redesignations are not coming. Medical cover is not there. We have sung this song for a very long time, and they are not listening to us. When we call for promotion of our members, the Council of Governors cites lack of funds. But when they are employing ghost workers and their concubines and their friends, then there is money. Are we the ones who do not know what we are doing, or it is the governors? We are telling the governors that the time for playing games with healthcare services in this country is over. And we are also informing the country that if the governors continues with their behavior, then what the government is trying to do of universal health coverage will be a pipe dream. We are not going to achieve universal health coverage with the mindset of governors of this country. And that is why we are providing them with a solution that they allow Health Service Commission to be formed so that health human resource can be managed in a central place. COG recently rejected the career progression guidelines that were approved by Public Service Commission, saying that they were not consulted. We must remind them that career progression guidelines are policies that fall under Schedule 4, Part 1, and it is a national government function. It is not a county government function. Their work is to provide services, healthcare services to the citizens, and not formulating policies. We are in a situation whereby each county wants to come up with their own set of policies to govern human resource. How is that possible? While we have a constitutional commission that is supposed to look into the HR policies in the public sector. The Constitution is very clear that Council of Governors have to implement policies that have been formulated by the national government, and they are not supposed to reject these policies. We are not going to allow a situation whereby every county wants to govern healthcare workers the way they want and outside the Constitution. We are telling them that they are calling for this, and we shall give them what they are calling for. We are not going to stand and see governors violating the rights of healthcare workers of this country. And so we say that governors must, and this one is not a request, they must abide by what the law of the land says. Asanteni sana.
Comrades power. Unajua tangia nizaliwe Kenya hii, mimi naitwa Brown Ashira, mimi ni katibu mkuu muungano wa maafisa wa afya ya umma na usafi. Tangia nikuwe Mkenya na tangia nizaliwe, hii ndio mara ya kwanza nimeona magavana ama amri ya rais haitiliwi maanani. Na haitiliwi maanani si kwa sababu ya kitu kingine, kwa sababu ya ubinafsi ya magavana wetu kwenye gatuzi. Rais, kwanza tunakupongeza, maana ulipeana amri na ukasema kwamba hiyo amri iweze kutelekezwa. Lakini sasa magavana pia wamekuja wameanza they're questioning the directive of the president. Mimi nilikuwa natarajia wakati rais alikuwa pale Mombasa, alikuwa wakati ile amri ya PNP ya kwamba waziri mhusika Mheshimiwa Duale na ama PS wote watafika hapa Nairobi na wakikimbie wakisha kwamba UHC wanapewa permanent letters. Lakini ile nishangaza, maana rais after kutoa amri, na rais tunakuomba futa hii watu yote. Kama mtu hawezi kusikia amri yako rais, inaonyesha kwamba hiyo mtu anafanya ile inaitwa insubordination. Uweze kuwa kwenye serikali alafu wewe rais anatoa amri na wewe huwezi kutimiza hiyo amri. UHC workers wako na haki ya kikatiba wako na haki ya kufanya ile kitu wanataka, na wako kazi saa hii. Wengine wao wako na mental torture, wengine wao wameumia sana, wengine wao ni ndugu zetu, wengine wao ni madada zetu. Sasa ni mbaya sana wewe kama wewe ni umeambiwa wewe ni wewe ni gavana na huwezi kutilia maanani kwa ajili. Leo asubuhi niliona kwamba gavana mmoja kwenye, sitataja ugatuzi hapa, aliandikiwa message ama ujumbe mfupi na UHC mmoja, akamwambia kwamba mimi nimeona una confirm watu kwa PNP, inakuaje you are not considering UHC? Akamwambia sikiza, ati sisi sio waajiri wako, ati waajiri wako wako kwa Ministry of Health. Tunamwambia governor ushindwe, na we are coming for you. Kama hutaweza kutekeleza UHC, na kama mnajua mmeshindwa na afya nzima, mtuambie irudishwe kwenye serikali kuu, maana sisi kama viongozi wa muungano wa unions tumeanza kuona kwamba mmeshindwa na mmelemewa. Kwa hivyo hiyo ni kitu ambacho sisi tunalaani, na tunaomba rais ya kwamba amri yake lazima iweze kutiliwa maanani na tunaweza kufuatilia, na kama 21 days itaisha na haijatiliwa maanani vile makatibu wamesema hapa, it's going to be a paralyze. We're going to paralyze everything mpaka kwa kwamba watu wa UHC wameweza kupewa kandarasi ya kutumu. Comrades power. Asanteni.
Asante sana. Thank you very much. My name is Serious Mutuma, the General Secretary, Kenya National Union of Pharmaceutical Technologists. What has brought here is the drumbeat from the summit of the Council of Governors. And we want to remind them, the governors in this country, that the money collected in this country as taxes should be able to offer quality health care to Kenyans. These UHC staff are working in counties serving Kenyans. And it will look like Kenyan taxes is only used for politicians only. When he mentioned about service delivery to the people, the same people elected, they start saying, oh, I don't know money, I don't know what. The government has money, and the president confirmed it. Yes. And because the Council of Governors have no monopoly of congregating in the summit, we have also congregated. And we want to tell them that you have invited us for an industrial action. And we will respond decisively because we have constitutional duty to defend the health of Kenyans. So, because the government wants to paralyze healthcare for their own reason, the Council of Governors want to destroy health of this country for their own reasons. We are telling them, within 21 days, as we have sent as unions, as the caucus, and we want us to tell our members, starting by in the Rigaria, the Bumizeras, let's come and dance this nice drumbeat by the Council of Governors. And we will give you exactly that dance you want, as long as you keep behaving as if health of Kenyan is not a priority. So the message today is, you have invited us for industrial action, and we are more than ready. We are more than ready for this industrial action. Thank you.
Good afternoon. So mine is to just echo what the others have said. So my name is Lilian Mumina. I'm the National Treasurer of the Kenya Union of Nutritionists and Dietitians. And maybe just to ask our dear governors, when they formed the COG, it was formed to ensure that the intergovernmental collaboration was effective. They were meant to ensure that the issues in the counties that are not as accessible are actually dealt with, the same way the other counties are actually dealt with. They were not actually established to come and interfere with policy and implementation. Theirs is to make sure that once the national government comes out with policies, implementation, guidelines and such, they ensure that they are enforced and they are implemented effectively. When you think about health sector in Kenya, think about that docket that people think it's too delicate to be ignored. People assume it's security, others think it's education. But when you ignore health, you're telling Kenyans that we don't care about you. We don't care about whatever you're going to do. We don't care about your parents at home. When your HC is not functional, what are you telling every other Kenyan who cannot afford the basic services? So it's quite unfortunate that we have the COGs or the Council of Governors, our dear elected governors, that we elected to ensure that they are taking care of our interests as a country, actually undermining any efforts that people have put in place to ensure that the healthcare of Kenyans actually work. So we are calling upon the Council of Governors to respect healthcare workers. We are not even telling you to give us a standing ovation, no. Just respect healthcare workers for the delicate services that they actually deliver. Because if you don't have the doctors, if you don't have the nurses, if you don't have the nutritionists in the facilities, who will take care of your mothers? You will not be able to actually carry them all to the peripheries or the wherever you usually take them. So let's promote collaborative governance and collaborative problem solving, where we're not addressing or masking issues. Let's address the root causes. And as my other counterparts have actually suggested, shida ikikataa, mtu akishindwa na kitu usema nimesare, mtu mwingine achukue. Like we've had these issues since the implementation of devolution, and it seems not to be going away. It's getting worse, as we have seen people wake up every day and just decide to come out with pronunciations that I think they've cooked from their kitchens or somewhere. So that needs to change. And as a union, we are definitely asking our members to get ready. If nothing is addressed, we'll join the others in the strike after 21 days.
Good afternoon. Naitwa Mohamed Duba. I'm the chair of Kenya Health Professional Society, 19 health professional association in the health sector. I think we are in a very grave situation. Health workers across many counties have not been paid salaries for over 3 months. These are people who live in rental houses. These are people who use public transport system to go to their place of work. These are people who need to put food on their table. How then do you expect them to provide service to Kenyans? The governors must have really a human heart, because we have some few counties who have really complied, and we don't understand the very reasons why quite a number of counties could not pay health workers for 3 months. They are the mercy of retail shops. Wanaomba deni, that's how they survive. Kweli wanaweza kupeana service mzuri? Hawezi. The other thing is about UHC staff. We have shortage of health workers in this country. Unless this cadre is absorbed on permanent and pensionable basis, then universal health coverage cannot be achieved. The very reason we are agitating for the absorption is for the service provision, because we know there is acute shortage of health workers in this country, and our people are not getting good service because of that. We wonder why the governors oppose when we suggest that this is the way to really reduce the issues, the shortages, and provide efficient service to our people. I think they don't mind of the health of these Kenyans. The other thing is about career progression guideline. We had a scheme of service which really made health workers to enhance to another level in their promotion and resignation. And the Public Service Commission have phased out a scheme of service and have come up with career progression guideline, where most of the cadres have really went through with Public Service Commission, with the Ministry of Health and Human Resource, and with the COG, and gotten approval. Now they are saying that there should be career progression guideline. How then do we really motivate our staff to move from one job group to another? Already we have a stagnated workforce, health workers in this country who are stagnated in one job group for over 15 years. I think it is very sad And for that purpose, we have resolved that we are going to give them 21 days, which is a good time for any reasonable people, persons or leaders to comply. So after 21 days, all the services in this country will be paralyzed. And therefore, they should do whatever humanly possible to ensure that this health workers' nationwide strike should not continue. If it happens, it's because they called for it, and because they are not making anything to stop or to alleviate things that are really can be simply complied with. Thank you.
Swali? Iko swali? Ama maneno imeeleweka? Tumesikiza maneno kwa muda mrefu. Kiswahili? Nafikiri alikuwa ameongea but ngoja nirudie tu kwa Kiswahili. Kama vile ambavyo tumesema, tumeunganika hapa leo kutathmini ama kuongelea masuala ambaye yametokana na mikutano ama na matamshi ya ile ambaye ni Council of Governors, ambayo tumeona ni kwamba yanadunisha hadhi ya wafanyakazi hasa wahudumu wa afya. Na sisi tumesema chanzo cha kulete ama cha kutengeneza Council of Governors ilikuwa kuwaweka pamoja, kwa sababu masuala yote yanayoshughulikia katika kila kaunti yana ile commonality, yani yanakuwa na uhusiano kiasi. Na jambo hilo moja kubwa ni lile la health. Lakini tumesema hivi, sisi kama huduma wa afya ambayo tunatumika kufanya hiyo kazi, tumedunishwa kwa kaunti na hawajataka kutekeleza majukumu yao, na kila mara tumeona wakipinga kila kitu ambacho kinatakiwa kumotivate ama kutupatia motisha ya kufanya kazi kama huduma wa afya. Jambo la kwanza ni lile la wale ambaye ni wana UHC ambao wamefanya kazi katika kandarasi duni kwa miaka 5 sasa, na licha ya kwamba kumekuwepo na advisory ama wameweza kuelezwa kwamba na ile ambaye alitangaza kuajiriwa kwao, Public Service Commission, ile tume ya kuajiri watu nchini kote, walisema na mwaka wa 2022 na mwaka 2023 waka-advise kwamba waweko katika kandarasi za kudumu. Council of Governors wakasimama kinyume na hiyo, kwamba wamekutana kwa ile kitu wanaita Intergovernmental Summit ya 2023, wakabadilisha hayo directive ya Public Service Commission, na kwa hivyo haikutekelezwa kutoka 2022 2023. Sasa tuko mwaka wa 2024 2025 tukienda 2026, tukawa tumeona hii imekuwa kidonda sugu, tukaitisha mgomo. Watu wakaenda kwenye mgomo, tukishinikiza kwamba wakati ambapo budget ilikuwa inaendelea tuweze kupata pesa zile ambazo hawatakuwa na sababu ya kutoweka katika kandarasi za kudumu. Basi tumewekewa pesa hizo ambazo zilikuwa zinahitajika, then zilikuwa hata wao wenyewe wanatamka zile ambazo zilikuwa zinahitajika na zimewekwa. Tuko na zile zilikuwepo zaidi ya 4 billion, alafu kuna zile zingine ambazo tumewekewa sasa 6.1 billion. So hizi pesa zote ziko na tunataka waanze kulipwa kama vile ambavyo budget ilikuwa inatarajiwa, kwamba waanze kulipwa kulingana na job group kuanzia mwezi wa 7, na tunataka wapewe barua ya kuwa confirm kwa permanent and pensionable kufikia mwisho wa mwezi huu. Ianze sasa na iwe tunatamatisha ama tunamaliza mwisho wa mwezi huu wa 9. Jambo lingine ni kuhusiana na ile kitu tunaita career guideline. Career guideline imekuja ikareplace ile ilikuwepo inaitwa scheme of service. Na kwa mfano nataka niseme hivi, wamesema Public Service Commission inatakiwa isimamishe kureview any career guideline for clinical officers, for any healthcare workers, na pia zile ambazo zimeshapitishwa ama zimekuwa approved zikuwe recalled. Ni kwa nini wamesema hivyo? Kwa sababu unajua policies zina life cycle ya 4 years. Wengi hapa hawana scheme of service, hawana career guideline. Public Service Commission in accordance kwa sheria ama kikatiba wameamua kutekeleza majukumu yao, lakini unapata Public Service Commission sasa wanakuwa ndio sababu ya magavana kukutana na kusema msitekeleze kazi yenu. na sisi tumekuwa tukishinikiza. Kwa mfano nitapeana kwa niaba ya clinical officer, tulianza kusukuma kupewa career guideline kutoka mwaka wa 2016. Kutoka 2016 tukaenda maandamano zaidi ya mara 4, ndio 2024 ikakuwa approved, na mkumbuke tulikuwa na mgomo, ndio ikakuwa approved na Public Service Commission. Na since that time nakumbuka ilipoanza mjadala wa career guideline, ilianza Council of Governors, Ministry walikuwepo, Treasury ilikuwepo, na kila mtu alikuwepo. Public Service Commission hawakuwepo. When this was sanctioned, it was sanctioned by the Ministry of Health. Ilianzishwa na Ministry of Health, ikaenda kwa Council of Governors, na ndio ikaenda kwa Public Service Commission. Caroline Mage ambaye ndiye director wa HR na wale wengine walikuwepo, the CEO then, tulienda na wao Naivasha zaidi ya wiki 2. Leo hii magavana wako na audacity ya kuja kusema hawakuhusishwa. Hawana hata aibu. Sababu kuu ni kwamba hawataki kutumia pesa ambazo zimetengwa kupromote healthcare workers, ndio waweze kuzivamia na kuzitumia visivyo. Ni aibu. Na kwa wale ambaye pia hawana, tunataka waendelee kupanda nyanya. Tukisema kwamba gatuzi kama Kirinyaga haijai promote any healthcare worker since ilianza. Kwani tuko Kenya ama tuko Somali? We don't live in a banana republic. Tuko na sheria za kufuata. Gavana fulani anaamua kwa sababu ndiye ako katika uongozi, anasema siwezi pandisha watu. Wanapeana kandarasi duni. Na sisi tumekuja hapa leo kupinga, kwa sababu wao ndio wanapeana kandarasi duni kwa ajili ya kuwadunisha watu, na wao wanalipa mishahara minono. Wana mahali pa kulala, wamejenga manyumba kila mahali. Sisi tuna rent. Mtu hajalipo mshahara miezi 3. Unafikiri utaishi kwa nyumba ya nani kama hujalipo miezi 3? Tuko hapa kwa sababu ya ghadhabu ama zile shida ambazo healthcare workers wanapitia, na kwamba Council of Governors badala ya kukutana kuona vile ya kutatua hili, wao wanakutana kwa ajili ya kuona vile ambavyo ya kuwatelekeza wahudumu wa afya na kuwaumiza katika kandarasi ambazo hazifai na kutowalipa mshahara kwa muda. Jambo la mwisho lile ambayo tumeongelea hapa, the SRC, the Salary and Remuneration Commission, ile tume ya mishahara ya kuratibisha mishahara, wamekuwa wakireview mishahara ya wahudumu wa afya, ya wafanyakazi wote nchini. Ikafanywa phase 1, ikakuwa implemented,